Availability and Utilization of Instructional Materials in Nursing Training Institutions in Anambra State. This article is written by 3 authors. First author is Anak Juliet Okwuchukwu. Second author Ndi Elkinokshabu Ike. Last author Aniech Jonaman Ike. Contribution and originality of the study is that, considering the relevance of instructional materials in teaching learning, it is necessary to know the availability and actual use of instructional materials in nursing schools. Although some studies have been done on the effects of availability, utilization of instructional materials in nursing training in some states of Nigeria, but to the best of the researchers' knowledge, no completed work has been carried out on this topic in Anambra State. There were also varying perceived views which were equivocal across studies. This further underscores a need for further investigation in this area. It is intended to provide scientific evidence on what actually obtains in different nursing schools regarding the availability, utilization of instructional materials. This descriptive survey research assessed the availability and utilization of instructional materials in nursing training institutions in Anambra State. A sample size of 298 students and 50 teachers were randomly selected from 4 nursing schools in Anambra State. Self-structured questionnaire was used for data collection. Inferential statistics was applied in testing the null hypotheses at 0.05 level of significant. Results revealed that student nurses and teachers believe that instructional materials, audio, visual equipment, 59.7% of students, 64.0% of teachers, PowerPoint presentation, 74.7% students, 58.0% teachers, anatomical models, 98.0% students, 80.2% teachers, medical instruments, 99.7% students, 96.0% teachers, good demonstration rooms, 95.7% students, 86.0% teachers, were available in nursing training institutions in Anambra State. 73.6% students and 74.0% teachers indicated that these materials were often utilized by tutors. Private, mission-owned schools make more available, 80.2% the students and 54.0% teachers, and utilize more, 82.8% students, 62.0% teachers, instructional materials than the government-owned schools. Significance difference, P0.05, exists in the availability and utilization of instructional materials between university-based and hospital-based nursing schools as well as between private, mission-owned and government-owned schools. There is positive relationship, ρ equals 0.603, P0.000. Between availability and utilization of instructional materials in nursing training. The study concluded that instructional materials were adequately available and often utilized by tutors in nursing schools. The researchers recommended that incentives should be given to nurse educators who utilize instructional materials in order to encourage them. Thanks for watching this video of International Journal of Medical and Health Sciences Research Volume 9 Issue Number 1.